Hello, welcome back. In the previous session, we looked briefly at the broad tradition of political liberalism and then zeroed in on Powers and Faden's approach to justice, while also looking at the 6 different dimensions of human well-being. So today we will go a little deeper into debates within political theory about the merits of egalitarian, prioritarian, and sufficiency theories of justice, and look at how we can ethically evaluate health disparities. So let's get started. So we begin with Powers and Faden's thesis. So justice for them is concerned with securing and maintaining the social conditions necessary for a sufficient level of well-being in all of its 6 essential dimensions, right? So as we will see, their theory contains both egalitarian and sufficiency dimensions of justice. And their approach is very different from the utilitarian version of justice, which is only concerned about the maximization of preferences, or sometimes called utility, or the libertarian versions of justice, which is only concerned about mostly with maximization of personal liberty. But for Powers and Faden, human well-being is more multifaceted than both of those theories would suggest, and so we need a more complex theory of justice in order to help us evaluate social institutions and practices. So their theory contains both, again, egalitarian and sufficiency elements, as we will see. But before we can understand what that means, though, let's take a look at what egalitarianism, prioritarianism, as well as sufficiency theory, and what they're about and what they mean. So egalitarian justice presupposes that certain kinds of inequality are morally unjustifiable. So this means that justice for egalitarians is concerned, among other things, the relationship between people as well as the relationship between groups of people. However, egalitarians really disagree on what sorts of inequality are morally problematic. So the important question to ask for egalitarianism is, what is the equalisendum, right? Equalisendum is what the thing of which we should all have an equal share, right? So equality of what, in other words, right? So egalitarians like John Rawls believe that everyone should have, for instance, an equal share of respect as morally equal citizens. So for him, this means that regardless of our social status, our race, our gender, we are all required by virtue of being a human being to recognize each other as having equal moral worth and human dignity, right? And we have seen that one implication is that we have the duty not to neglect anyone's needs and desires, or to treat a person merely as a means to our ends, right? Either for a political end or for a personal end, right? So at the same time, though, Rawls does not think that everyone should necessarily have the same income or social rank, right? So one of his principles of justice, the difference principle, we talked about it last week, ensures that inequality is to the benefit of the least well-off. But inequality in itself, for Rawls, is not morally problematic. So there are a number of objections to egalitarianism that I think deserves our attention before moving on to understanding how Powers and Faden address these objections. So the first objection is called the leveling down objection. So according to some interpreters, egalitarians find equality to be a morally valuable thing in itself, right? That is to say, equality is something that has intrinsic value. So a lot of critics of egalitarians would point out that egalitarianism, for instance, could achieve equality, say, equality of well-being, for instance, not by raising up the well-being of everyone, but by reducing the well-being of the better off, right? So instead of bringing the worse off's well-being up, equality can be achieved also by undermining the well-being of the well-off. So no doubt a lot of people will find this very problematic, right? And so as a result, it is suggested that, according to our moral intuitions, that equality must not be a moral value in itself, right? How could it, right? And there's another thought experiment that also seems to undermine egalitarianism. So imagine a world, let's call it world A, where everybody is equally well off, but at the same time everybody is miserable, right? So contrast that with world B, which has some inequality, but most people in this world are better off, right? So which world would you prefer? Now, if you choose world B, according to these critics, it must mean that equality is not really that significant as a moral value. Now, can you spot some problems with these arguments? Well, for the defenders of egalitarianism, there are at least two problems. First, if equality is an important value, for instance, it does not necessarily mean that it is the only value, right? Other values such as self-determination and the priority of helping the least well off may also factor into an egalitarian's moral analysis, right? So just because equality is an important value, it doesn't mean that it's the only value or the most important value in every situation. So in other words, egalitarian justice or equality is a defeasible value. That means it can be defeated by other moral considerations. It is not in other words, moral absolute. So, and secondly, critics are also not sufficiently aware that egalitarians disagree as to what is the equalisendum, right? What is it that should be equalized? And under what kinds of conditions or circumstances, right? It may not be the case that it is morally good to equalize our income, for instance. However, it may be justifiable for us to demand that everybody be treated as a moral equal under the rule of law, right? So we need to ask the question, what does egalitarians actually want to be equal? Another objection against egalitarianism is the suggestion that equality is not a relevant moral value in many areas of life, right? So other theories of justice, for instance, may deprioritize equality as a moral value by bringing other more important considerations to bear on social issues. For instance, prioritarian theory, like that of John Rawls, uses the difference principle to argue that the principle of fair equality of opportunity as well as economic inequalities can be justified only insofar as it benefits the least well off, right? So what matters is not equality of wealth or social status, but whether or not the least well off can become better off with an increase of inequality, right? So if inequality happens to benefit the least well off, it is justifiable. Furthermore, it matters whether people have equal opportunities to make a decent living and to have a fair chance of filling important social positions in society based on merit and not arbitrary reasons like gender or race. So for Rawls, his version of justice takes into account the relational aspects of justice, right? And is committed to providing everyone with equal opportunity, but it does not say that inequality is in itself morally problematic, right? So let's move on to the next theory, which is the sufficiency theory of justice. So sufficiency theories of justice, in contrast, do take into account the intuition that a basic level of resource is necessary for human beings to avail themselves of the opportunities that exist in a society, right? So, for instance, a severely disabled person may be slightly better off financially because of a flourishing economy, right? Or that person may be better off in terms of wealth than other people, right? But that doesn't mean, but in itself, that this severely disabled person is able to live a decent life with decent opportunities, because without other kinds of resources and social policies that would make society more accessible to her as a disabled person, her life wouldn't be very different as a result of having more money alone, right? So sufficiency theories are concerned mostly about trying to lift people up to a basic level of flourishing. So they're more focused on absolute poverty, And so they're not as focused on the issue of inequalities, right? So what they're concerned about is everyone should have a minimum level of resources as well as opportunities to exercise their capabilities. So Powers and Faden claim that theories in both camps, right, both the prioritarians as well as the sufficiency theory, do not really take into account how relative inequality can have real empirical impacts that could undermine human capabilities and opportunities, right? So political philosopher Alexander Kaufman makes a similar point, citing R.H. Tawney, another thinker, a political thinker in the 19th century, which says that the concentration of wealth and property in the possession of a tiny minority produces a system that vests in particular classes a special degree of public influence and an exceptional measure of economic opportunity. So differences of wealth of this sort, Tawney suggests, can account for the hierarchical quality of social systems in 19th century England. Right? So inequalities can have empirical effects that could undermine other people's ability to live a decent life. And we'll give you some examples. So recognizing the limitations of these various theories of justice, Powers and Faden provides a solution, which is to focus on, rather than either bare opportunities or resources, but focus on a minimum level of human well-being, as we have seen from the last session. So Powers and Faden's equalisendum, right, that to which we should be equally distributed, is in fact a minimum threshold level of well-being. So everybody's entitled to a minimum level of human well-being. However, this focus on the dimensions of well-being has important implications for inequality of many sorts, right? Because inequality of health outcome, economic inequality, political inequality can all have important implications for human well-being. So as non-ideal theorists, as we talk about non-ideal theories and we contrasted that with ideal theories, Powers and Faden are attentive to how disparities of one sort can lead to bad disparities of other sorts, right? So more importantly, disparities of different kinds can also combine to undermine different dimensions of human well-being in very significant ways. So inequality has a kind of what they call derivative importance insofar as it affects human well-being. So inequality is not morally wrong in itself, but it's problematic insofar as it has empirical effects that undermines human well-being. This is a very important distinction here. So economic measures of sufficiency also presuppose an account of human well-being anyway. So for Powers and Faden, it is not controversial to base a theory of justice on the 6 dimensions of human well-being. Now, secondly, Powers and Faden also give us some ethical basis for evaluate what kinds of inequality should matter morally to us, right? So in short, inequalities are unjust for them if inequalities are contingently incompatible with securing and preserving a level of sufficiency for each of the dimensions of well-being. So one example of how inequality might negatively impact well-being is called competitive utilization, right? Robert Gooding brought this up in his discussion of utilitarianism. He argues that, quote, the measure of how useful goods such as money are to you in pursuing your ends depends on how much others have and use it in bidding against you for scarce resources that you both desire but both cannot simultaneously enjoy. So that sounds very abstract. What does that mean? Well, one phenomenon that embodies this phenomenon is the phenomenon of gentrification, right? So when young professionals return to a poor neighborhood, right, they begin to price poor residents out of that neighborhood, both by outbidding them in the housing market, as well as by transforming radically the neighborhood, right? So the presence of these younger, well-off professionals, then, when they come back to the neighborhood, it begins to impact those neighbors who are less advantaged, right? So their success is directly affecting the well-being of other people, right? And this might then later on go on to also affect educational opportunities, how social life is structured in that community, as well as people's access to healthcare, right? So this is one example of how our relationship with each other in the social context can cause inequality to have to have an effect on other people's well-being. Another case study of how neighborhoods can affect one's well-being can be glimpsed from the experience of a bartender who moved from St. Clair in Michigan to Seattle for new opportunities, right? So let's give you some context. In a middle-class town like St. Clair, nothing is really out of reach from a middle-class working person, right? Over there, $50,000 can purchase you a condo, right? So that cultural environment then is also very democratic in that prominent members in the community are defined not so much by their education or income or social prestige, right, but by how committed they are to their towns and their local communities. In Seattle, by contrast, which is a professional, educated people dominated city, right? This same person who was born in St. Clair and works as a bartender, who moves to Seattle, is then priced out of almost everything, right? Food is more expensive, housing is more expensive, and the important sort of influencers and people who have prestige are working for Amazon or Microsoft, right? So these tech company elites then begin to dominate social life there. So for this bartender, he says, it feels better to be at the center of your own poor society than on the margins of someone else's rich one. That's very important, right? So this bartender moves back to St. Clair, where there's more belonging, respect, as well as, ironically, even though it's not as rich of a city, has better opportunities. So in a lot of ways, radical inequality of these sorts can erode certain cultures where we might find valuable, right? Cultures where communities value our commitment to loyalty to each other rather than our professional prestige, right? And cultures like that are becoming rarer and rarer in our world, where education and professional advancement begins to become more and more important in our social life together. So Powers and Faden also argue that what counts as sufficient well-being is also contextually determined, right? So for instance, in a modern technologically advanced society, it is more important than ever before to know how to, say, use a computer, to own a smartphone, to know how to read and write, and to have some cultural and legal competence, right? And to have a professional skills that is gained through education, so that it's marketable, right? But this bag of things that we value today wouldn't be very valuable many years ago in the United States, right? Because things have changed now, technology has advanced, and so social context and culture has shifted, right? So some places then will require more overhead for basic human flourishing than other places, depending on the cultural context of the place. And this also means that not all failures of well-being are instances of injustice, right? So before treatment for instance, AIDS were developed or widely available, it would not be an injustice for people to die from AIDS, right? However, if treatment is widely available, right, and it's shown that certain social barriers are rendering certain groups more vulnerable to AIDS than others, then it is possible that that scenario raises questions about justice. So it follows that a well-being theory of justice, though it does not require equality of well-being, will call many health disparities and outcomes into question, right? So at the same time, we need to remember disparities in themselves are not necessarily unjust. But if disparities are of conditions that are both preventable and treatable and are due to largely to and are not due to personal choices, then they become unjust, right? And now we also have to remember here that, as we talked about it in the previous sessions, that personal choice is also in itself severely influenced and conditioned by our social circumstances, right? So especially when it comes to children, that is true. So disparities related to children are of especially great moral significance because children are just at their early developmental stage where the failure in one dimension of human well-being, such as attachment, nutrition, health, and respect, can undermine that child's future in very dramatic ways, and we know that from all kinds of research. So, and this is called diminished futures. So, children are also uniquely susceptible to suffer from compounded negative determinants of health, such as environmental poisoning, bad housing, pollution-related diseases, as well as obesity, right? Children lack the agency, unlike other people, to really avail of themselves the opportunities that exist, even in their neighborhood. So it's unlikely for them to ever get out of their situation if they start out badly. So they're kind of locked into their circumstances in a lot of ways. So the unique situation of children and people who suffer from various forms of disability really reveals, I think, the limits of Rawls' principle of fair equality of opportunity. Because opportunity depends on an agent's ability to take advantage of opportunities, right? Even if everyone has the formal possibility of having access to jobs and things like that, not everybody has the capacity to actually take advantage of those opportunities, right? Even if education is available to everyone, not everyone is able to avail themselves of these opportunities. So opportunities does depend on certain prior outcomes, such as a person's reasoning ability, educational level, health, natural talent, and self-respect. So one example of diminishing future that comes from the legal scholar Daniel Markovits, he brings to our attention that education makes a huge difference. How educated your parents are makes a huge difference in your life. Educated parents with a professional degree are much better able to train their children, right? So top public schools in the nation, for instance, that are funded by real estate tax, spend 2 to 3 times as much per student per year than the middle class schools do, right? So elite schools invest in far more teachers and teachers with advanced degrees, right, and training themselves. So they draw about 80% of their students from, as we know from the research, that top 4% of the income distribution, right? So 80% of the students who go to elite schools come from 4% of the top of the income distribution. So, and they invest 6 times the national public school average. So this means that children who are born into working class or poverty level families are almost guaranteed to have a less than average education insofar, and then the cycle continues and it is perpetuated throughout many generations. So lacking certain outcomes, right, or certain threshold levels of well-being, opportunities are just abstract, right? So outcomes and opportunities are interrelated in very important ways. They have an interdependent relationship. So it is not helpful sometimes to just simply talk about equality of outcome or equality of opportunity. What is important for us to think about is what source of outcome matters and how they're related to real opportunities for people. So it's not as important to have equality in many areas of our life, right? Income doesn't have to be equal. Social rank doesn't necessarily have to be equal. However, equality is very important when it comes to attachment and respect. Everybody should have the opportunity to form meaningful attachment, especially if they're children, right? So if some people lack respect and strong attachments, then other dimensions of well-being will also be undermined, especially for children. So Powers and Faden's well-being, their understanding of well-being is based on a non-ideal theory of justice, again, which provides some moral guidance on what are acceptable levels of inequality in various realms. So this is why it is important to have some basic understanding of the way social determinants of health relate to the 6 different dimensions of well-being. So there are a variety of ways through which social determinants affect human well-being. The first one is that one social determinant with compound and pervasive effects on one dimension of human well-being, right? So one social determinant can affect one dimension of human well-being. So it is often simpler to focus on how just one single social determinant affects human well-being, such as access to healthcare, right? However, the world is a lot more complex than that. So talking about simply one determinant in isolation can obscure and obstruct the necessary task of looking at fundamental structures of society. So this leads to the second way that social determinants and well-being are related, which is that overlapping social determinants can have profound and pervasive effects on one dimension of well-being, right? So many different social determinants can affect one dimension of well-being. So we have seen in our previous sessions that access to healthcare accounts for only a very small portion of health outcomes in the country. However, if a lack of access to healthcare is combined with, say, exposure to carcinogens or a lack of sanitation or bad neighborhood, then health would be severely compromised in that case. However, if social determinants often influence more than one dimension well-being, we need to also look at another way that social determinants are related to human well-being. So the third way of looking at the relationship between social determinants and well-being is one social determinant can have profound and pervasive effects on a cluster of dimensions of human well-being, right? So policies and structures can at times, for instance, signal second-class citizenship, such as implicit bias in healthcare delivery systems, things like that. This could also undermine some people's self-esteem and social standing, as well as their ability to care for dependents, leading to other invidious disparities. But there are also examples of great inequalities of what is called the dominant goods, right? So what is a dominant good? A dominant good is something that can, in every society, that can easily translate into other kinds of goods, right? So at some point in our history, perhaps it is your social status or your aristocratic rank, right? Which can also translate into wealth, translate into respect, translate into having a good education and things like that, right? In some contexts, maybe it's education, maybe it's your technical know-how that can translate easily into other goods that are essential for human well-being. So if wealth, for instance, is one of the dominant goods of our society, which means that it can translate to other things such as respect, influence, and education, and so on. It could buy political influence, it could command respect and dictate policies and impose bad living conditions on other people due to your political influence. Then vast inequalities in what is called the dominant good become very problematic, right? You can have winners in one sphere of the economy who then determine who are the winners and losers in our economy. So another social determinant that also influences multiple dimensions of well-being is, again, education, right? So because education, again, is perhaps, we can also call that a dominant good in our society because it often translates to more income, respect, and better health outcomes. So lack of education can also lead to lesser well-being in all of these different realms. But it doesn't mean, and this is important, it doesn't mean that there has to be an equality of dominant goods is the only just outcome. It merely means that society needs to place limits on how these dominant goods can influence other areas of life, right? So for instance, there has to be limits to what we can buy or sell, right? So if more people can buy political influence, then that means this good will have a disproportionate impact on other people's life than it needs to be. But if we restrict wealth to just operations within the exchange of consumer goods, then perhaps it wouldn't affect other areas of life as much, right? So we need to think about how are dominant goods affecting different outcomes. So sometimes you can have multiple social determinants influencing multiple dimensions of human well-being, right? So when that happens, you have interactive and cascading effects of multiple determinants that also affect more than one dimension of health, leading to overlapping social determinants with very profound and pervasive effects on a cluster of human well-being dimensions. So this is often the most morally significant scenario, where catalytic social determinants set in motion, right, for them an initial adverse effect on just maybe one or two dimensions of well-being, which in turn also adversely affect the other dimensions of well-being, resulting in a cascading interactive pattern of adverse effects, each compounding the severity of the effects on multiple dimensions of well-being and reinforcing their probability. And we'll go back to this when we go into an empirical analysis of how social determinants work in the next couple of sessions. So there are also other forms of densely woven patterns of disadvantage. One of them is social subordination, right, which can be either domination or oppression. Domination refers to condition in which your self-determination is thwarted by other people or institutional factors. Or oppression, which is systemic or institutional constraints on dimensions of well-being that undermines your ability to self-develop, right, to grow and to develop your capacities. So the philosopher Iris Marion Young tells us that there are actually 5 different kinds of oppression, right? You can have exploitation, where people have overwhelming power over you, such that you can really freely participate in a discussion or to influence your circumstances. Or marginalization, where the group simply excludes you as a member of their community, right? And they don't take you seriously, don't listen to your voices. Powerlessness could be you just lack any kind of influence or control over your own life as well as your environment. And this could be at work, this could be in your neighborhood, this could be in a variety of contexts, right? This could also be something that happens between people in terms of interpersonal dynamics. It could also be cultural imperialism, right? Which that maybe you come from a particular cultural background that is undervalued or it's marginalized in a particular society. And then you feel like in order to be yourself, you have to conform to somebody else's cultural patterns. That could also lead to oppression. And then there's also outright violence, right? People can use physical force to prevent you from development, as well as prevent you from determining your own fate. So self-determination and well-being, of course, are related. Those whose self-determination is undermined, such as those who experience racism regularly, they also have their well-being undermined, right? So conversely, those who are oppressed also have a hard time getting their voices heard by others, right? So these are all important dimensions or patterns through which our well-being is undermined. So it is also important to note that self-determination, our freedom to choose, can also be thwarted not only by other people's outright violence, but by overlapping social determinants, such as lack of access to education, lack of opportunities to develop your rational capacities, your ability to reason both practically and morally, right? And then we also talked about before how some certain industries can also do public disinformation campaigns, which undermines the truth, right, for the public. Then it also makes it hard for people to make an informed decision about how they want to behave, such as smoking, right? If all the research is telling you that, oh, smoking is good for you when it's in fact not, then you also lose the capacity to determine yourself. So a theory of justice guides the remedial task of ameliorating some of the conditions that undermine human well-being. So Powers and Faden believe that their moral theory captures the twin moral intuitions or impulses of public health. Number one, public health seeks to improve human well-being by improving health, right? And then second, to do so in such a way by focusing on the needs of those who are the most disadvantaged. So how do we come to these two moral impulses? Well, they say we do it through what's called in moral philosophy reflective equilibrium. Well, so what is the reflective equilibrium? Well, basically we start out with a kind of moral assumptions, right? We all live our lives with certain moral values already operative, right? We know certain things that we take to be right or wrong. And then we kind of try to reflect on what those principles are. We're asking ourselves, okay, what is behind why we make these sorts of ethical judgments, right? Why do we consider this act wrong? Like lying to get money in the bank. Why do we think that's wrong, right? And then we try to come up with moral principles that would explain those moral intuitions or embody those moral intuitions. And then we try to look at, which is the second part, how we actually behave with each other, right? How do we actually embody these moral values? Are we practicing these moral values, right? So in sometimes we would see that we don't really live up to our moral values. Then if that's the case, we have to correct what we are doing, right? But sometimes we realize in our activities, in our relationship with each other, we actually don't believe in these moral values that we proclaim that we do. When that happens, we need to revise our moral values, right? We need to say, okay, what is the equilibrium? Can we coordinate these two poles of moral reflection, right? That what are our stated values and assumptions, and what do we actually do in practice? When we do this long enough, we begin to have a better understanding of what is it that our moral values actually are, and what sorts of moral values are actually good for us to continue to have, right? So this activity of kind of going back and forth between our values and what we actually do in practice is called reflective equilibrium. So we have seen from the two intuitions or impulses of public health, we can derive a positive point of justice as well as a negative point of justice, right? The negative point of justice is trying to correct conditions that would lead to the undermining of human well-being, whereas the positive point of justice is about doing something to improve human health, right? So some of the negative points of justice are concerned about first and foremost, disadvantaged social groups, right? So we have seen that how multiple social determinants can interact with each other to worsen health outcomes. While at the same time, we also have to acknowledge that not every kind of health disparity is an instance of injustice, right? So health disparities are only instances of injustice if it fits, for Powers and Faden, three different criteria. One, injustice happens only if certain outcomes are causally related to domination and oppression, right? If it's related to domination and oppression, then we have good reasons to judge that the disparities are unjust. And two, if a group experiences inadequate well-being due to interactive and cascading effects of multiple social determinants leading to undermining multiple dimensions of well-being, then we also have good reasons to consider the situation unjust, right? And furthermore, if the disparity tells us that a particular population consistently experiences vastly lower levels of human well-being compared to other groups, then there's also a good reason to consider the situation morally problematic, right? Even if causal factors are not clearly established empirically, right? Why? Well, because this situation could lead to interacting and cascading effects, leading to the undermining of multiple dimensions of human well-being. And it could also, as a result, undermine self-respect and self-determination, right? It could also lead to preventable illnesses and difficulty in coping with illnesses. So that's why we should be concerned about disparities, even if the causal factors cannot be established empirically right away. And poverty is also a great moral concern because, as we know, there's a relationship between economic well-being and physical well-being and health. For instance, there's a 40-year differential between those who live in major industrial countries and those who live in Southern Africa, right? And in the year 2000, a 15-year-old could expect to live to about 70 years in the United States, whereas a 15-year-old in Uganda in the same year could only expect to live to about 50 years old. So economic resources really do matter. But here we also know that economics impacts our educational standards in the United States, right? So even here, education matters. As we can see, in 2002, between the ages 25 and 54, the death rate is about 591 out of 100,000. right, for people who have less than 12 years of schooling. Whereas for people who have more than 12 years of schooling, their death rate drops to 217 out of 100,000, right? So we also know that people who experience sustained poverty, as we'll go into this more, we'll go into this in more detail later on. People who experience sustained poverty also start to develop fatalistic attitudes sometimes, right? They also have sometimes lack of hope, and it could lead to behaviors that then further undermine their health, right? Of course, not everyone who is in poverty would necessarily behave that way, but there's a huge causal relationship between poverty and certain psychological factors, right? Mental health is affected most certainly by our economic well-being. And one of the other important things that we have to consider is always the well-being of children, right? Because we know developmental concerns make children's well-being especially important and urgent, right? Because children really can't avail themselves of opportunities, even if they're available, because they lack agency, right? They are children, and they need their parents, they need other people. They're very much dependent on how other people treat them and take care of them. So their only hope really is the action of others, right? In 2003, we know most of the 10 million children under the age of 5 died of easily preventable and treatable diseases such as diarrhea, pneumonia, malaria, right? And we also know that children's future very much depends on whether or not they're flourishing, right? So it depends on their flourishing at earlier stages, because otherwise it leads to what we talked about earlier, diminished future, right? And it's also important to talk about the positive point of justice, right? Justice is not only corrective, but it also moves us to do something positive for human beings, namely to promote their health in the context of public health. So gaps then between health gaps and health outcome gaps and disparities become very important. But again, as we said before, not every disparity is morally significant. So which ones are significant, right? So let's take a look at this first chart. Just by looking at it, can you really see what's morally relevant, right? Well, just by knowing that on the left column and the right column, we have different life expectancy, for instance, right? The first one says one group of people can live to about 75, right? The other group is 63. So there's about an 11.8 year gap. But just by looking at this gap alone, do we know which ones are morally significant and not? Probably not, right? Because as we said before, we need to look at whether or not these disparities actually fit certain moral criteria in order to be considered morally significant. So let's take a look. Some of the questions we might want to ask to help us evaluate the moral significance of disparities are of the following. Is the mortality rate gap, for instance, due to diseases that are preventable and treatable, right, based on current technology and level of resources, right? Is the mortality rate gap due to unjust dynamics of domination or oppression? Is the mortality rate gap due to interactive and cascading social determinants? Does the mortality rate gap put the disadvantaged group below a sufficient level of well-being, right? Is the mortality gap reflective of disparities along multiple dimensions of well-being? Now, answering these questions will help us determine which health gap matters. So let's look at the same mortality gap data again, but this time with actual content, right? So let's take a look at all four. The first one is the gap between U.S. African male versus U.S. African males with 8 years of education. So one group has 13 plus years of education, the other group has only 8 years. And you can see there's a 11.8 year gap between them due to education, right? So here, because we know, as we will talk about, access to education is important, and there's a huge disparity, right, in the United States for accessing education based on socioeconomic status. And so then this disparity in health gap becomes, mortality gap becomes morally significant. But the second one, what about the difference between right-handed people and left-handed people? Well, unless we can prove that left-handed people are are dying early because of some kind of oppression, domination, or cascading effects of social determinants, then their 9-year gap perhaps is not morally significant, right? So this one we probably can put on the back burner a little bit, morally speaking. What about the next one, between U.S. white males and African American males? Well, that's also a significant gap, right? In this one, we also have reasons to think that there are institutional factors that we need to address in order to try to close that health gap, right? How about the next one? Well, Japanese citizens versus American males. Well, there's a little bit of a disparity gap. Well, first of all, it's really not that great of a disparity, right? And secondly, we don't know the difference is really due to those factors that we would consider morally significant, right? Based on the questions that we would ask in the previous slide. So that's this is just to provide you with an example of how we can morally evaluate which disparities really matter, right? And which ones don't matter as much as the other. So hopefully this session has been helpful in helping us understand some of the ways that public health ethicists can determine which health disparities are morally significant and which are not as significant.